With only about 10% of all Americans vaccinated for COVID so far, stadiums across the nation are suddenly front and center. NPR's Allison Aubrey explains why.
Gillette Stadium near Boston is not hosting a football game today. Instead of shots to the end zone, the action here is getting shots into arms.
So how many people will be vaccinated here today?
It's going to be more than 2,000 people will be vaccinated here today, right across what you see here.
Dr. Atul Gawande is a surgeon and a professor at the Harvard T.H. Chan School of Public Health.
And when you're at your max capacity, what is your hope for how many people you'll be able to vaccinate overall?
We will definitely be over 5,000 a day, and we will go north of there as much as we can.
Back in December, Gawande spotted trouble. The COVID-19 vaccines had been developed in record time, but there was no playbook to administer them quickly.
To be honest about it, it's been all breakthrough and no follow-through.
Many people are confused about how to sign up, where to go, and states have been scrambling to scale up capacity. Gawande saw a way to help, so he picked up the phone.
I contacted Bob and Jonathan Kraft the week before Christmas.
The owners of the New England Patriots. He explained how he and a team of partners had scaled up COVID testing early in the pandemic.
We saw that people couldn't get tests, hospitals couldn't bring it forward, and we created a partnership that was all about being the contractor that could bring this to scale.
Now they could use the same playbook for vaccinations. They just needed someone to loan them a space.
So of course, we jumped at it, and we're really excited that we have the privilege of being able to be part of this.
And Bob Kraft likes what he sees.
I think every college in the country should do it, every municipality.
And on Friday, the NFL said it will make all of its stadiums available. So along with Coors Field in Denver, State Farm Stadium near Phoenix, and Dodger Stadium in LA, a growing list of mega sites will be part of the solution.
Football players are used to the 2-minute drill over there on the field. This looks like a 2-minute drill here.
We've had to learn to do the 2-minute drill 2,000 times a day.
In a matter of a few weeks, CIC Health, the company he co-founded, has brought on teams of vaccinators and support staff to help match people with appointments.
This vial holds 10 doses.
Rodrigo Martinez of CIC Health oversees part of the operation.
And all of the different syringes get a sticker and a record, and we have 6 hours to use them.
Appointments are scheduled as doses become available. It takes just a few minutes to move each person through.
If for some reason someone might feel a little dizzy or might need some medical attention, we have 2 different teams with EMTs and paramedics, one on each side.
And to mark the occasion,
we can actually invite them to come into the stadium.
Is this the celebratory moment here?
That's right. It's really an opportunity for all of us to communicate the importance of getting vaccinated, not just for ourselves and our family, but for our community and our country. This is important for all of us.
There's always time for selfies and smiles.
I'm very excited to be vaccinated today.
Dominique Page and Susan Garrett, both healthcare workers, say there's a lot to celebrate.
I'm feeling very relieved. Probably hug my grandma. Very excited for that. It's just a sense of it just feeling safe, safer, I should say.
And your supplies, do you have enough to keep up?
We don't have enough. But we could do much more and will do much more as there is more supply.
Vaccine makers need to produce millions of more doses per week. The authorization of the 1-dose Johnson & Johnson vaccine would help. But with such a mammoth undertaking, shortages are possible.
We ran out of swabs for tests. Here, we don't have enough of the syringes. Producing enough so that everybody in the world can get 2 shots in their arm, we weren't doing that as of 3 months ago or 4 months ago.
And one more challenge. New strains of the virus could make the vaccines less effective. The good news, there's a way around this, too.
That's part of what makes this such a game changer. These vaccines are going to be adaptable almost on the fly.
So you can retool the vaccine to fight the new strain of the virus.
You're exactly right. Can completely retool and change the formulation so that it works against any of the new strains.
While the pandemic is far from over, Dr. Gawande is relieved to finally have a game plan.
Seeing what I saw in the hospital when our ICUs were overwhelmed, and now seeing medical people making this happen, it brings tears to my eyes. It is a return to normalcy, and I don't know how better to contribute.